A ceramic inlay is a dental filling made of ceramic and produced in a dental lab. They are generally used to treat the consequences of dental caries. Here you see the upper jaw of a patient. He has two leaking plastic fillings in the posterior teeth region. You can clearly recognize these as the black gap in the margin. The black arrows mark the teeth. He already had two other fillings replaced with ceramic inlays in the past, and these are very hard to distinguish from the rest of the teeth. In the picture, the two white arrows indicate these respective teeth. He would now like to have the remaining two teeth treated with ceramic inlays as well. First, the old fillings are removed. Cooling with water prevents the tooth from overheating. The removal of the fillings and the cutting itself are performed under magnification, in this case with medical magnifying glasses, because the dentist wants to remove as little healthy tooth substance as possible. The dark discolorations underneath the fillings are partly the result of previous amalgam fillings and partly the result of caries. Thus, tooth discolorations don't always have to be removed, so long as these discolorations aren't caries. After removing the old fillings, the caries detector is applied and rinsed off. This process verifies if all carious dental material has been fully removed. Now the final cut takes place. Lastly, the edges are broken with a novaculite. More on that in the video by the same name. Prior to taking the impression, a sealant is applied. After a specific contact time is achieved, it is rinsed off, and the impression is taken for the technician. The impression is also examined with magnifying glasses. The tooth and preparation margins must be clearly visible. You can find out more in the video Dental Impression. A week has passed since the cutting. Now the ceramic inlays are glued into the patient's mouth. You see the two teeth, both of which have been provided with temporary dentures. The teeth are protected against saliva, the tongue, and consequently against moisture with a cofferdam. It's the violet membrane, because the ceramic glue is extremely sensitive to moisture during the hardening process. Ceramic inlays must be glued. The technical term is called bonding. You can find out more in the video Bonding and Searing. The temporary dentures are removed and the ceramic inlays are fitted. Again, a precise fit is verified with medical magnifying glasses. Now the tooth core is cleaned with special polishing compounds. After the tooth cores have been dried, the blue searing gel is applied. The gel is initially only applied on the enamel areas. You can find details under the keyword searing. After a certain time period has elapsed, the searing gel is also applied to the dentin, and it is then thoroughly rinsed off with water after a short while. Now the tooth is treated with numerous chemicals. After a specific contact time, the tooth is intermittently dried with air. Here, precise workmanship is particularly important. Contact times are specified by the manufacturer and should be strictly observed. This is why a precise dentist uses a stopwatch. Finally, the bonding compound is applied, ideally a two-phase glue. The two phases should be mixed prior to the bonding process and should start to harden by themselves. The lamp only accelerates the hardening process after the two parts have been mixed and have begun hardening on their own. Although the use of two-phase glue is more cumbersome, it has the added advantage that the glue continues to harden after the lamp has been turned off, if it hasn't already completely hardened during the lamp application phase. With glues that only harden when a lamp is used, there's always the danger that certain areas won't harden completely. Glue that doesn't harden completely is poisonous to the tooth. Toothaches and/or subsequent root canal treatments are possible consequences. Only now is the ceramic inlay placed. A short pre-hardening process is begun with the lamp, after which all the remaining materials are immediately removed. Finally, a glycerin gel is applied so that the glue can harden thoroughly, even at the edges, as this is only possible when there is no oxygen present. You can find out more in the video entitled Air Block. After hardening, the teeth are polished. Smooth surfaces don't allow bacteria to take hold that can cause caries to develop. In the best-case scenario, even the dentist won't be able to recognize the glue joint. Ceramic inlays offer a unique option for teeth restoration, provided the elaborate gluing guidelines are followed. Here you see another image of a patient's jaw. The old amalgam fillings were removed and the teeth were provided with ceramic inlays. You can find out more about an inlay in the video by the same name. Alternatives to inlays include well-known filling materials such as amalgam, cements, or glass ionomer cements. However, these materials don't last as long and must be replaced every couple of years. This process always results in the loss of healthy tooth substance, so after a number of years, a root canal treatment will be necessary. This is why one should always try to use high-quality materials in young people and encourage improved brushing techniques. Although high-quality fillings are, of course, initially associated with higher costs, you will save money, suffering, and time in the long run. The risks of core buildup are negligible when performed by an experienced dentist. Nevertheless, complications may occur in individual cases, possibly requiring additional measures. Each additional measure may in turn lead to complications, which themselves may eventually lead to tooth loss. At this point, we will only discuss the specific complications that may be encountered when employing the inlay cut. These include, for example, injury to surrounding structures such as the tongue, cheeks, nerves, blood vessels, neighboring teeth, and neighboring roots with the respective consequences. A dental nerve infection, which would lead to a root canal treatment. A leaking inlay resulting in secondary caries. In principle, all dental work is associated with the risk of a dental nerve infection. This is why you should fill your teeth with high-quality materials that will remain tight with proper dental care.